Perfect. Okay, today we are continuing with a topic we discussed 2 weeks ago before Christmas. I had to pause it so that we can get to talk about the holiday blues because Christmas was here. But we are continuing to talk about suicide. There are various levels of it or stages of it: suicidal ideation, suicidal thoughts, suicidal attempt, and suicidal, obviously, completion. Yeah, those are the three main levels: ideation, attempt, and completion. And each of those levels demand a level of assessment and intervention. Obviously, we're now wanting it to get to completion. 2 weeks ago, we talked about protective factors. In other words, things that we need to help us not to get there. We also talked about the risk factors. What are those things that would make someone susceptible to suicide? I'm going to run through them today, and then we talk about signs, the warning signs. These are critical. When people come for assessment, this is what you as a caregiver, you as a leader, you as a practitioner, and you as someone who is having mental illness need to be aware of the signs. That's all we can do. If we can catch it early, we give ourselves a greater chance of making sure that it doesn't happen. And the only way to catch it early is to know the warning signs. I'm going to talk about a few of them, 10, 15 of them, as much as time as we have. But let me run through the risk factors. If people have these things, you know that they are at the risk. Now, the level of risk may be different, but at least there's some risk that this person might do this, might think about suicide, attempt suicide, complete suicide. So what are those that I talked about 2 weeks ago? One, if there's a history or diagnosis of mental illness, someone who already have mental sickness, they've been diagnosed with bipolar, schizophrenia, depression, anxiety, personality disorders, one of those and many more that I can't name here. If they have those as underlying illness, then it's a risk factor for a practitioner to consider. What does that mean? It means I need to probe more. This person may have this. The second one is alcohol and substance use. If someone is struggling with alcoholism or addiction, those two things, alcoholism are those who are suffering from drinking alcohol, obviously, and addiction is those who are addicted to drugs. If they have those, that's a red flag for me. Hopelessness and helplessness. If someone is feeling hopeless and helpless, perhaps they've lost a breadwinner, they've lost the anchor of the family, they've lost business, they've lost something that makes them begin to feel life is over, there's nothing more to live. That's hopelessness and helplessness. That's a risk factor for me to consider. I can't get into it. As a professional, you have so many ways of exploring and assessing for that. What's your plan for the future? What's going to happen next year? The person says, I have no plan for the future. I'm just living now, for now. That's a warning sign. Impulsive and aggressive tendencies. People that just do things, they're not planning, they just see you today, they want to marry you tomorrow. That's impulsive, that's aggressive. Someone goes out, buys a flashy car, no plan, no thinking, just saw it, liked it, bought it. Someone didn't mean to travel, suddenly they're in Miami, suddenly they're in Cancun. You never had they were going to travel. Pick up their bag, they're gone. Those are very impulsive. And aggressive tendencies will be someone that flashes, moves up and down. They're happy now, unhappy tomorrow. That floating, that movement of mood might make them to also do things they will regret. Major illness, terminal illness, mainly. Someone that has cancer, that has been told they have 6 months, 1 year, 6 months to live, or they will never recover from this. That's a risk factor to watch. Previous suicide attempt. I have to access for this. We are professional. You want to ask this question. Have you had suicidal ideation? Have you had, I'm not gonna put it that way. Have you thought about harming yourself? That's a tender way of putting it. Now, if you want to be direct, have you thought about killing yourself? Depending on who it is. So if there is that history of attempts, not just thinking about it, because if they say I thought about it, then you have to ask how much. Did you have a plan? What was the plan? How accessible was the plan? If the person is in the middle of nowhere and they are saying, well, my plan was to shoot myself, and they're in the middle of nowhere, there's no access to weapon, no access to firearm. Yeah, it is a plan, but really they don't have access to it. Family history of suicide. Someone they know, someone in the family had died of suicide. Mom, dad, uncle, auntie, grandma, grandpa. You have to assess all that. Has anybody in your family that you know or you heard about attempted suicide? That's or died of suicide. That's something that is a risk factor. Job loss, business loss. I just had a patient who was going to commit suicide because he lost big money in business. And that was his thing of ending it and not taking the shame of losing. For some cultures, that's a biggie. For some, it's not a biggie. So job loss, business loss, relationship is a big factor. You hear people say, I'm going to kill myself if you leave me. Now, some people say it because they want to scare you to stay, but some people are dead serious on it. That's a risk factor to consider, especially those who are impulsive in their relationship. They engage today, they disengage tomorrow. They go from 0 to 10 to 100 over 2 weeks. They just met you, and now they are talking about marriage. They don't know you. All they know you is what they see, but they want to marry you like yesterday. So that's a sign to watch out for. Someone that has easy access to lethal weapon. Someone who is a veteran, they know how to use weapons. Someone who is a collector, they have access to it. Someone who is a firearm enthusiast, they just collect guns, they hunt. Those are warning or risk factors to watch out. Cluster of suicide I talked about. If a particular population or culture has a cluster of suicide, things people are just dying by suicide, it's just that season. It's happening here, it's happening there, it's happening here, it's happening there. That's a risk factor for you as a professional, because those who are thinking about it, they're hearing that somebody has already completed what they are thinking about. So it kind of demystifies it for them. So there's a chance they might also try it. Local lack of support, where there is lack of support, people who don't have support, medical care, medical attention, they are just suffering from something they cannot deal with. They don't have the medication to help them. It just looks hopeless and helpless. That's a risk factor. For instance, someone who's been having bouts and episodes of depression just comes before they manage it, it comes again. They just have a month or two break and they are normal again. They just keep going through that. Nothing is working. That's a risk factor for you to be mindful of. That this person might be thinking, I don't want to go through all this. I've been going through this for the last 2 months or 2 years. I might as well just go. So those are the risk factors that we talked about last 2 weeks that you need to be aware of. Now, I want to talk about the warning signs, the risk factor. Just because you have depression doesn't mean you're going to die or you're going to want to commit suicide. A lot of people live through it, but it's just a red flag. Now that red flag now goes into warning sign that somebody's actually engaging in it. The risk factor helps you to prevent people from going there. Take precautionary steps. The warning signs means there has to be an intervention, one-on-one intervention, to explore that this is happening. And because it's happening, we got to do things to stop it from getting to the end. So very important, very important. So what are those? What are those? Number one, people beginning to talk about killing themselves. Now, they're not going to always spell it out like that for you. Some will, but so many will code their words because it's a taboo for many cultures. It's not something you discuss easily. So people are going to say things like, I wish this will all end. I wish I don't have to deal with this anymore. Those are code words for, I wish I would just go to bed and wake up and not wake up. That's a warning sign. Killing themselves. That's a warning sign. Ending it all. That's a warning sign. Never wake up. That's a warning sign. Now, if you assess 9 out of 10 people who are dealing with serious mental illness, maybe 8 of them are going to say, yes, I've thought about that. So it's not yet a red flag just because someone says, I've thought about it, therefore we need to pull all strings. But you need to be mindful and explore more. So those who talk about killing themselves or ending it all, that's a warning sign. When people are looking for a way to kill themselves. Now, this is more subtle now that we have the internet. People can do all their research on the internet. People can check out whether they want to use chemical, they want to use weapon, they want to use whatever means, jump over the bridge. They can do all that research without really telling you what they are researching. But in the time past, it had to be that they might go to a pharmacist, someone that has knowledge of medicine and medication, and ask questions like, how much Tylenol or how much aspirin or how much of this medication does one need to take so that they can really end their life? They might ask those questions. Well, how many can I take, and it will be too dangerous for me? Those are questions. If people are asking those questions, that's a warning sign. Now, for most people who commit suicide in recent time, when they go through and trace their internet activities, you see a lot of activities, a lot of research, a lot of sites that they go to that talk about suicide and how to make it less painful. So you'll see that. How to buy a gun, how to obtain a gun lawfully, how to use the gun usefully. They might do research on those who have committed suicide, what they did, how to make it less painful for their loved ones who will be alive, how to write suicide notes, how to distribute their affairs, those things you would see. So we watch out for it. You may be privileged to have someone who will say, hey, what do I do if I really want to end it? It doesn't always come that way, but that could happen. Those talking about being and feeling helpless and having no reason to live. This you would hear a lot. I really want to end. I don't know why I'm alive. I really have no reason to live. I don't feel like I should be here. I don't feel like there's any reason why I should be this kind of problem. I'm suffering too much. If anything happens to me, to be better. You hear that a lot. Those are warning signs. Talking about being a burden to others. Now, this is what we hear a lot from our clients, from our patients. They don't want to be a burden to their family members. They don't want to be a burden to their loved ones. They feel like they have been a burden all their life. Back and forth hospitalization, back and forth, a lot of money spent on medication. They feel like they have become a problem that they need to solve to release not just the pain that they're experiencing, but to release their loved ones from the burden of carrying them back and forth. I hear that a lot. And that's why for most of them, when they come to hospital and they are able to interact with one another, it's a heaven, it's a mecca for them, because for once they can feel free. For once they also have other people who are dealing with what they are dealing with, and they can freely talk about how they feel, as opposed to at home when they may need to be guarded because they don't want to burden their family members. So when someone begins to talk about, oh, I'm such a burden, I'm such a problem, my family have to go through hospital, pay all this amount of money, that's a warning sign. When someone feels like they are trapped, there's no way out. And this happens mostly for people who have terminal illness. You have 6 months to live, you have 1 year to live. Someone might say, instead of enduring that 6 months, I'm gonna die anyway, so why go through this pain? Why put my family into this debt? So they have to pay all this money to keep me alive and give me medication so I can just manage the pain and eventually die. I might as well move on and save them the pain. So those are warning signs to be taken serious. So you see the connection between the risk factors and the warning signs. So someone who is suffering from terminal illness, someone may also, if you notice, increased use of alcohol and drug. That may be a way of ending it or numbing the pain. They may just be escaping from the pain that they experience and not wanting to deal with it. So, but you will see an increased use, constant use of alcohol or drug, wanting to escape, not wanting to deal with the reality of their life. That's a warning sign that we need to be careful and considerate. Acting anxious and agitated and taking risky behavior, behaving in a risky way, driving riskily. I've had patients who've driven on the other side of the road, and God help them. Either they had an accident, they bumped into something, they hit something, and they survived. But clearly, it was a suicide attempt. They are trying to end it. I've had patients that I asked them, what was your suicidal plan? What was the plan? And I said, well, I wanted to drive under a truck. I'm gonna drive very fast, drive under a truck on the freeway. That was my plan to end it, but I didn't do it for one reason or the other. So when you see people engaging in risky behavior, when you also see people engaging in things fast and quick, they want to go to Cancun, they want to do things fast, or all plans are all jumbled up. They just want to accomplish it like they're going somewhere. They have plans to do things and then end it. Those are warning signs. Sleeping too little is a warning sign. Perhaps that's the one you notice most if you live with someone who is dealing with mental illness. If you can't sleep for 1 day, 2 days, 3 days, life changes. And life changes for a lot of people. In fact, for most of our patients, when they come in, one of the first things we want to stabilize is the sleep. They gotta be able to sleep. No matter what medication you give them, one of the indications is that they are able to rest their body and eat, sleep, eat. Half of them, when they come to hospital, they are not sleeping, or they are not eating, or both, or they are sleeping too much all around. They sleep, they wake up, they sleep, they wake up. So you want to stabilize that. So when you have someone who paces around all night, all day they are awake, they're just there, that's a sign to watch out for. Sleeping too little or sleeping too much is a sign. Now, withdrawing and isolating themselves. If you also have someone you live with, you're going to see that. If they, and this is general with all mental illness, if they live alone, They are all alone in their apartment or house. If they live with a family, they live with other people, they are all alone in their room. Even if they share a room, they are all alone in their bed. So that's the level of isolation, not wanting to engage with people, wanting to be left alone in their room, on their bed, on their corner. So that's a sign that we notice and we have to do something. It's not if they isolate one day, obviously. So if you're seeing a pattern of isolation, they just come out barely to eat or barely to do something, or they just go to work. Once they get back from work, straight to their room, they lie down, they're sleeping, they wake up just to go to work. That's a sign to watch out for and engage. Showing rage, I'm talking about seeking revenge. Now, if someone is wanting to end their life because they think somebody did something horrible to them and that they cannot bear, one example will be rape. Another example will be trauma and abuse. People who've been traumatized, people who were raped by others may not want to deal with the shame of it. So you might hear them thinking about, how do I take a revenge? How do I take a revenge? And the revenge, the search for revenge or how to take react or how to revenge on that person takes that person and overwhelms them. That's a sign. Extreme mood swing. In other words, the mood is happy now, next minute they're unhappy. They're happy today, tomorrow they are very, very sad. And nothing is moving them, nothing is exciting them. You want to watch out. Now, there are cultures, and I'm going through this, there are cultures that find it difficult to ask for help. If someone, definitely, you look at them, you know they need help. You offer help, they are not accepting it because the culture is one that there's a stigma associated with help me. It means you're showing weakness if you accept help. If you see that someone needs help, but not accepting help, it's obviously a sign that that person may have resigned to their fate. And they are just saying, there's nothing that I can do. There's nothing that anybody can do. I might as well just live this through and go with it. And then, of course, cultural and religious belief. If you have someone who has one of those risk factors or a few of them, and they are from a culture where suicide is honored and celebrated, or they believe in a religion that celebrates suicide, that says if you die for your personal problem, it's an honor. If you take your own life, there's an honor associated with that. Obviously, that's a warning sign. If you combine it with a few of the things we've talked about here, it means you have to do an intervention. And it's not just when we see one of these signs, we rush into conclusion. The signs just point you to look for more, explore more, be more observant, pay attention to the person. It may not necessarily be suicidal or suicidality. It may just be something that you might have to intervene and relieve that person of progressing, either from fleeting ideation to solid ideation to planning and to actually doing it. And finally, the final sign is those who are exposed to somebody who has committed suicide. Just being exposed to the story of someone who's committed suicide, seeing someone who's committed suicide. I had a client last year whose twin sister died of suicide, and they were lying in the same bed the night that his twin sister died. So she did not know that the sister had taken overdose of drug to die, and the sister left a suicide note. So that experience alone makes her want to do exactly what her sister do. So when she has problem, she told me, I keep thinking, well, my sister doesn't have to deal with all this anymore. She's in heaven. She's at peace. Why do I have to deal with it? She's gone. She's at peace now. So I might take that route. She says, it comes to my mind all the time that this may be the quickest route to solving my problem. So when someone has been exposed to suicide and suicidal, or someone who has committed suicide, it's also a warning signs when they begin to isolate. So you have to take all these factors and explore them a little bit more to make your own conclusions. But bottom line, if there's any and all of this, many of these warning signs, we need to seek professional help. You're not a professional unless you're a doctor, unless you're a psychiatrist, unless you're a nurse, unless you've been trained to assess for suicide and gather enough information to say, this is moderate, this is severe, this is mild, because that's the way we rate them: moderate, severe, and mild. And then obviously, if it's mild, the intervention will be mild. If it's moderate, you want to watch. If it's severe, it's hospitalization. If you're not trained to do that, you want to seek professional help. And if you are here, you want to be trained to be able to do this. TIMFA, the Institute for Marriage and Family Affairs, offers a 14-week course on mental health and addiction counseling. One of the modules will talk about suicide, preventing suicide, managing suicide, caring for those who have attempted suicide, all the whole nine yards. But more importantly, how to assess someone who has mental illness of possibility of suicidality. Assessment, that's the key. That's the key to preventing suicide. The first key, obviously, is what we are doing: education. Educate people. The more we know, the better. The second key is being able to assess someone who is at risk. And at risk would be someone that has all those risk factors that I pointed out. But when we see the warning signs, we're able to assess. So if you are interested, shoot us an email, call us, contact us. The classes are starting January 15th. We have a good payment plan. The idea of this course is to generate practitioners who will be versed in intervening, who will know at least what to do as a first responder. We're not trying to make you a psychiatrist. That takes years to be. We're not trying to make you a mental health therapist capable of being licensed abroad. That takes years to do. We're wanting to give you enough information to help with the crisis of suicide in our communities, in your community, in your church, wherever you are, so that at least we can save life. That's what this is about. So again, classes starting for certified mental health and addiction counseling course starting January 15th. We're registering now. We have a payment plan for a token. You can join the class, and then you have 5 whole months, 5 months to pay it off. And that's also one of the things we're doing to help everybody and anybody that has interest. If you are a counselor, that's how I ended up here. That's how we ended up here. We were marriage counselors, marriage and family counseling. That's what we do. Then we realized that our patients and clients are suffering from addiction. We had to get information on addiction. We realized, oh, they're also dealing with mental illness. We have to be trained in mental illness. We realized we have couples who are dealing with grief. And then we went and schooled and got information on certification in grief. So if you are a counselor, a coach, you're a therapist, or you're a leader, you're a church pastor, you have people who are under you, you need the skills. You do need to at least be a first responder, know what to do, especially if you live in a community where you don't have a lot of help. You gotta know what to do. Thank you all for joining me. If you have a question, I'll be more than happy to answer that.